Hello guys, welcome back to Pharma Palette. Let me ask you something. Have you ever looked at antiviral drugs classification and felt like all the names just look similar and confusing? Acyclovir, ganciclovir, oseltamivir, ribavirin. It feels like everything sounds the same but still does not stay in our mind. When you try to memorize it normally, it just disappears after one reading. But don't worry, in this video, we are going to make antiviral drugs very simple using easy memory tricks. We will start with non-retroviral drugs in this video, and in the next video we will continue with retroviral drugs. So everything connects clearly step by step. So relax and let's simplify this together. So by using this simple code that high H, we will try to write this classification. So just remember high H. Where H means it is the first class, that is anti-herpes virus drugs. Anti-herpes virus drugs. I means it is the second class, that is anti-influenza virus drugs. Anti-influenza virus drugs. And one more H means it is anti-hepatitis virus. Anti-hepatitis virus drugs, which are also called as non-selective antiviral drugs. So these are further divided into two classes. One is for hepatitis B and one is for hepatitis C. So in the antiviral drugs, especially in the non-retroviral class, remember it as a high H, where H means it is anti-herpes virus drugs, I means anti-influenza drugs, H means anti-hepatitis virus drugs, which are also comes under the non-selective class, which are further divided into hepatitis B and hepatitis C drugs. Now let's try to write this tricks for each class. In this anti-herpes virus drugs, so remember, let's divide this group into three things. One with cyclovir. That means some examples we'll write with cyclovir. And in the cyclovir, remember it as a very famous gang visit. And second part, we will be writing it as I try. So it will be having some DNA related drugs. And the third one, remember it as found crazy fox. So if you remember these three tricks, this complete examples, you can easily write it. So anti-herpes virus drugs, remember it as cyclovir. In that, a very famous gang visit. Now by using this, let's try to write the examples. So here, A means it is the first example, that is a cyclovir. V means it is valacyclovir. F means it is famiciclovir. G means it is ganciclovir. V means it is valganciclovir. Now coming back to the second part, I try some DNA related drugs, where I means it is the first example, that is edoxuridine. Edoxuridine. And T means it is one more example, that is trifluridine. Edoxuridine and trifluridine. Now coming back to this third part, found crazy fox. F means it is formivircin. C means it is cidofovir. Fox means it is foscarnet. So any drug, if it is having vir in its name, that means it comes under antiviral drugs. Now coming back to the second class, that is anti-influenza virus drugs. So here remember one simple code, that is ROSA. One simple code, that is ROSA, where R means it is rimantidine. O means it is oseltamivir. Z means it is janamivir. A means it is amantadine. So, ROSA for anti-influenza virus drugs. R means it is rimantadine. O means oseltamivir. Z means janamivir. A means amantadine. Now, coming back to this last class, that is anti-hepatitis virus, which is also called as the non-selective drugs. So, here in the hepatitis B drugs, remember it as TAL as a trick, and for this, remember it as RIBA is studying in inter. RIBA is studying in inter. And in hepatitis B, remember it as TAL. By using these tricks, let's try to write the examples. So here, hepatitis B drugs, T means it is tenofovir. A means it is adifovir. This is also called as adifovir dipivoxil. L means it is lamivudine. So either remember it as TAL or remember it as LAT. Hepatitis B, LAT. And for this hepatitis C drugs, just two simple examples. Riba means it is ribavirin. Inter means it is interferon alpha. That's it, and this classification is done. Let me just repeat this entire classification for you once again. So the antiviral drugs, initially coming to this non-retroviral drugs, remember high H to remember the subclasses, where H means it is herpes virus drugs, anti-herpes virus drugs. I means it is anti-influenza virus drugs, and H means it is anti-hepatitis virus drugs. So here the first class is anti-herpes virus drugs. So here just divide this tricks into three different parts. One, some drugs will write with cyclovir, some drugs will write with I try, and some with found crazy fox. So remember cyclovir, I try, and found crazy fox. And this anti-herpes virus drugs you can easily write with these tricks. In the cyclovir, remember it as a very famous gang visit. A means acyclovir, V means valociclovir, FAM means famciclovir, GAN means gancyclovir, visit means valgancyclovir. And second part is I try means some DNA related drugs. I means edoxuridine. T means trifluridine. And the next part is found crazy fox. F means it is formivirsin. C means cidofovir. F means foscarnate. And coming to the second class, that is anti-influenza virus drugs. Remember simple code, that is ROSA. R means it is rimantadine. O means oseltamivir. Z means zanamivir. A means amantadine. So coming back to this anti-hepatitis virus, these are also called as non-selective drugs. So these are further divided into hepatitis B and C. For hepatitis B drugs, remember the trick as LAT or TAL, where L means it is lamivudine, A means adifovir, T means it is tenofovir. Coming to the C, which is, remember for writing this hepatitis B, hepatitis C drugs, remember that RIBA is studying in inter. RIBA means ribavirin. Inter means interferon alpha. So that is the complete classification of antiviral drugs with simple tricks. So that's it. It's actually not that complicated. It just looked confusing because of all of those similar names. But once you catch the pattern, it becomes much easier to handle. And honestly, that's how most of the pharmacology is. Not difficult, just needs the right way of learning. Today, we did the non-retroviral part, and in the next video, we will go into the retroviral drugs, and it feels much easier after this. So just take a few minutes, go over these tricks once again. You will see how much easier it feels the second time. So yes, don't stress too much about getting everything perfect. You are learning. That's what matters. So, and if this helped you, do like the video, share it with your study partner. It might make things easier for them too. And if you want more such simple classifications, you can subscribe to Pharma Palette. I will see you in the next video. Thanks for watching.